Okay, so I'm going to talk about the process of getting started with Clipboard. So what you're going to do is search Clipboard in your app store. You're going to seek Clipboard help. You're going to download the app, and when you download the app, they're going to ask you to enter your phone number or your email. Then you'll be taken to like a page where you upload all your documentation, which is your MRIs, just any vaccination, and your physical for the year, and your PPD. The basic things that you're gonna need to start at a facility. And I would say the process for the documents to get cleared is about like a week or less. I took my time while applying for Clipboard, so it took me a little longer than it will take you. Second, after you submit all your documentations, they're gonna ask you to go for a drug tests, and also to submit your background search. That takes about 3 days. So I went to LabCorp, and I'm from New York, so you know how that works. It's pretty basic. You go there, it's a urinal drug test. You have to bring your a state ID, and they take everything from you. You go in the bathroom. You don't wash your hands till you pass the nurse or whoever's there the urine sample. When that's all completed, you pass your drug test. Woo! It's time to go. So now you go on the app, and one thing I could say about Clipboard app, if you live in New York, all the locations are pretty far, like 2 to 3 hours, sometimes 4 hours to get to. So be mindful when you are signing up for Clipboard and you live in New York City, because it's going to take you a while to get to the facilities. But sometimes I don't mind, because the wage pay, to me, it's worth it. Because if you're staying in Brooklyn, you're going to get paid about 18 to 21 an hour. But if you take a shift somewhere farther, you'll get like 28, 29 an hour guaranteed. So that's a pretty good thing about Clipboard. Also with Clipboard, as soon as you clock in, your time starts. Then when you clock out for your break, make sure you take your break. I don't care if you have a hard day, take your break, because they're not going to pay you for that break. So if you take it or not, you're not going to get paid. Take your break. And we all need time to musa. We know as a CNA or PCT, it could get very overwhelming, especially with the amount of patients that we are given a day. And that's another thing I'm going to talk about a little later in this video. So, all right, I started by always taking your break. Take your break. It's very important to yourself and also the client, because you'll be in a better mood, So after that, you complete your patients, then you do your documentation. And when you're clocking out, it's always going to ask you, did you complete your documentation? So please try to complete your documentation. Don't wait till the end of the shift. You're from Clipboard, go speak to the director, the supervisor, get your username and password to go online, whatever system the facility is using. In New York City, a lot of them use Sigma. So go on Sigma, complete your patient care notes, and that's how they get paid. So if you don't complete your charting, they're not going to get paid for what you did with the client for that day, whatever shift you're on. So when you're clocking off a Clipboard too, it's also going to ask you, did you complete the documentation? Yes, no. I never put no, so I don't know if it's going to allow you to clock out if you put no. But after you finish your shift, you did everything you need to do, and it's time to clock out, you're going to clock out, and then you're going to find a nurse. And this is very important. Don't leave without finding a nurse to sign for you to get paid, because if a nurse does not sign for you to get paid, you won't get paid. And also, if your location on your phone isn't working and they're not able to pinpoint that you were in the facility at the moment, you won't get paid. So it's very important to make sure your phone is working, the location is on precisely, because they'll ask you that. You can also put only track while you're using the app if you don't want Clipboard to know your every move. I'm sure they're not looking at everything you're doing. So basically I went over when you set up your account, when you do a shift. I love that you get paid right away. I'm not sure of how the taxes are going to affect me, because Clipboard, one thing they don't do is take taxes out of your check. So, you know, Uncle Sam always gets his money. So, I mean, I feel good sometimes when you clock out and you get that $200 and you can do what you need to do for the day with that money. But also, remember, you're going to have to pay Uncle Sam his taxes back at the end of the year. So, that's something to think about with Clipboard. And also, I noticed with Clipboard, when you go into the facility, they're going to give you the hardest assignment. I am willing to do anything because I'm here to work, as long as I have the support from the facility. And just understand, you're not going to have the support from the other people that work there, because they're going to feel like, oh, you're from Clipboard, we're going to give her the hardest. No, speak up for yourself, be respectful, and ask for help when needed. And what I noticed is that a lot of people from Clipboard are going to help you. So don't worry about it. Just take a musa. And if you're uncomfortable and you feel like the shift is unsafe for you, it's okay to say, okay, I can't do this. Speak to the nurse and let them know that you're going to go speak to the director, whoever the head nurse in charge, and let them know, you know, I'm not feeling too well. I'm going to have to leave for the day. And then just let Clipboard know the situation, or if you're not feeling well, make sure you go to a doctor so you can have a doctor's note. Because one thing Clipboard will do, they will lock you out the app if you don't show up for the shift. If you keep doing that, like, you have points. And I think when you go below a 0, obviously you're not going to be able to pick up shifts. Right now, I'm below a 0 because I went to a facility and I got sick. But I'm going to send my doctor's note. That's one thing about them. They're very understanding. They will unblock, you know, the block they have on you. So, is there anything else I can think of to share with you guys? No. But welcome to my channel. Please subscribe if you want to hear more about other apps, because I'm going to do other videos. This is my first video, so I'm sorry if I'm nervous or I'm shaking. I just wanted to get this out here because I noticed that I don't see a lot of information about agencies that are on your phone, you know? So if you're like me, a student, and also like you work in another field and you're trying to get your foot into patient care, I would say that using the app is a great way to go. It's not only for CNAs, it's also for RNs, LPNs. But I won't cover their pays and stuff, like, because it's basically the same thing. But of course, if you're an RN, you're going to have a different pay rate from a CNA. And you have to have your BLS certification to even take jobs on the app. So that's very important. If you are a student, you work in the CNA field, you work in the health field, just always make sure that your BLS is up to date. And thank you again. Welcome to my channel, and I look forward to seeing all of you guys on my journey. You'll see this journey of mine. I have many things that I love to do, and I always change my mind. But one thing my grandmother used to tell me, as long as you're alive and you're kicking, you can do anything that you put your mind to. I mean, I don't think I'll become the president of the United States of America, because, yeah. Thank you. Later, guys.